All right, good afternoon, everyone. I'm here with Rich Collins, the Emergency Services Director for Sarasota County, and Chuck Henry, our Health Officer for Sarasota County. And they're going to start off by giving you a little update on what's going on and why we're here. And then we'll have an opportunity to ask a few questions. So with that, I'll let Mr. Henry go first.
Thank you, Steve. Good afternoon, everyone. Chuck Henry with the Florida Department of Health in Sarasota. We're real excited today to talk about the opportunity to move to this space at the mall. We've been operating most of our vaccine clinics out of our downtown Sarasota Health Department site. There's, as many of you know, there's some construction going on across the street, so we've been looking for a place that would handle a large capacity that we could move to. We've been working with the county for a number of months to identify that. We have done a drive-through out at Twin Lakes Park last week, very successful for us, but as we look forward to the summer and the summer heat, there's some concerns about staff all day long out in the heat as well as patrons, and so we're looking for a place we could be long-term that handles large capacity, and we're very excited to have the opportunity to move into this space. We'll be starting vaccines here as early as tomorrow with our first big second dose event. So with that, I'll turn it over to Rich to talk a little bit about their help in the process, and we're very thankful both to the mall staff and the county staff for helping make these arrangements for the health department.
Thank you, Chuck. Rich Collins, Emergency Services Director for Sarasota County. As Chuck mentioned, Chuck's team were looking for a place indoor that would be able to handle a large amount of citizens moving through for vaccine. We were able to work with the mall staff and leadership to put this together. Big thanks, as Chuck mentioned, to them for their support and working with us throughout this process. We look forward to moving forward with them tomorrow on beginning the second dose vaccines here at the mall. Speaking of vaccines, our registration system has now been up for 7 days. As of this morning, we have over 95,000 accounts within the registration system. There's a few things we're working on. Today was our 5th clinic sending out for appointments for tomorrow. Overall, the system's been working very good. We did have a bump in the process this morning where approximately 170 of the second dose vaccines got a wrong message. Our team is reaching out to them personally to fix that so they get in here tomorrow for their second dose vaccination. But overall, the system has been working quite well. Additionally, with those 95,000 plus registrations, we are working on, as I've mentioned before, an account number system that'll be on each account. And that account may be 1 or 2 individuals, depending on how the account was set up. So each account will have a unique number. The team is finalizing that process. The big thing we're working on is scripts, so that each morning as new registrations come in, they get added to that list. And as that finishes up, we'll be moving forward with that. Our communications team will be putting out messaging on how to access that, to understand how it works, and messaging on our website so that they'll understand where they're at or where we're at in the vaccine process and what account numbers we've reached up to. So we continue to work that as well. Overall, the team has been working very hard to continue that operation. And we look to anybody that has questions. They can call the 861 VAX number. Our communications team is also working actively on social media. If there's a direct message, they're working with individuals. And we are working on a team that will be available here at the mall as well for registration or account questions if individuals come by the mall. So we continue to work that as well. We appreciate all the help in getting the information out to our citizenry. As we talk about not just the vaccine registration, but also access to the mall, where to park. And I know the team has been working and sharing information with you all on that as well. We look forward to the operation beginning tomorrow. And with that, I think we'll take any questions you might have.
Yeah, so let's just start with why this location. Talk a little bit about accessibility. There's obviously buses that stop right outside the doors here at this entrance to the mall. Can you just tell us about that?
Sure. Number one, we were looking for a place that was as centrally located in the county as we can. So far all of our clinics have been on the north end, which is not very convenient for residents in Northport or Inglewood or Venice. So we're trying to find a central location that handles a large capacity that as the vaccine becomes available, we can operate 5 to 7 days a week, continually putting people through and bringing our numbers down in terms of people waiting for vaccines. In addition to that, this site offers a tremendous amount of parking and easy access through public transportation, because there's bus stops, in fact, right outside the entrance that people would enter for this vaccine operation, as well as a transfer station, I think that's the right term, on the corner of the property here. So we're real excited about the accessibility of this site. You know, it's not a drive-through, so people will have to get out of their car, and I understand that, but overall it offers shelter from rain on rainy days, shelter from the heat as the summer moves on, and will allow us to operate continually as vaccine becomes more available.
The other sites are going to be, they're still going to be operational until, like you said, the weather, you know, picks up with the heat and everything. They're still going to be operational, right? This is just an additional.
So this will become our primary site. At this point, we have no plans to operate again at Twin Lakes Park. We also do not have plans to operate at our downtown health department site, primarily because the construction continues. It creates some hazards for large groups coming in and out. So this will become our main site, and as we hope to have more vaccine than we can even handle at this site in the future, we'll begin to do other events around the community in addition to this when the vaccine is available.
So this is taking place of Twin Lakes.
This will be the county's, yes, primary vaccine site. And one of our goals is to have a site that we can be in long-term every day as long as vaccine is available.
The problem we had this morning with the notifications of 170, how did that happen? Why did it happen? And how are we fixing it? Which you kind of already answered, but how are we fixing it?
So as I understand it, there was the wrong date in the message, which is why when they responded, they received a message that date was already full. The team has done a post-mortem on that to take a look at how that happened to prevent that from happening again, as well as reaching out to as many as possible through social media, calling. Our team is working on it right now, and we appreciate everybody's understanding as we can. I mean, 7 days in, 5 clinics. I want to see a 99.99% no issues. A little glitch this morning that they're working on to make sure it doesn't happen again.
And was it the operator error, or was it the Everbridge system that?
But I think it was a key punch error on the date as it was being sent out.
I just have one more comment on that. I think for any viewers out there that received their initial dose at the health department on December the 29th, 30th, or 31st, that's the group that should be coming tomorrow and should have gotten appointments for a second dose tomorrow. If you got one of those notifications, you tried to confirm it and it told you, sorry, it's full, that notification should have given you a time. Just plan on coming at the time that notification told you, because your second dose is due, and we want to ensure, as Mr. Collins said, that everyone that got their first doses, the 29th, 30th, and 31st, has an opportunity to get their second dose. Now, it's important also to know that under CDC guidelines, we should wait until at least day 28 for the Moderna second dose, but it can be after that. And so if they don't get here tomorrow for that second dose, we still want to give it to them. And so we'll still be trying to reach out to them. They can reach out to us, but we want to make sure that everybody that gets a first dose has an opportunity for second dose.
And the people that got for the 3 days that got the first shot already, and some of them went out on emails to some of the people. Some of them are elderly and they don't know what to do. What are we doing about that?
So, and I think you're referring to the Eventbrite system we used initially for the first.
I think it was an Everbridge that just got them
So,
yesterday or today.
so initially though, we were using Eventbrite through an email, and what we did is we extracted from their consent forms the contact information, and we loaded that into Everbridge, because remember, we told people that needed second doses, they didn't need to register in Everbridge. But we were able to extract their contact information and then load that into Everbridge to send out the messages today. And I think it worked fairly well, except for that about 170 individuals that had a date thing, and we're trying to work hard to correct that.
Okay, so the question was, there was an email that went out instead of a phone call for some of the elderly people. What do they need to do once they got that email?
If the email came out, the email should have a place to confirm the appointment.
A radio button? I mean, what is it?
It should be a radio button, am I correct on that? Should be a radio button that they click in the email to confirm the appointment.
And then does that send it, or what does it do? I mean, I've asked for a copy of it, but I
So
haven't got
once it confirms it, then it creates in the database a confirmation, and so we have a list of who's coming. We also get a list of who didn't confirm, and we do try to reach out to them on the second dose side because we want to make sure people get second doses.
So the date that they're supposed to be there is on that email.
I haven't seen the
On
initial.
initial email, it should be.
Yes.
The one that they confirmed.
Correct.
So
All the information that they need should be on that email.
That email, okay.
Okay? And I can help you with that offline as well. Does anybody else have any other questions?
I'm curious, this site anyways, this seems a little bit smaller, but how do you all feel in the sense of efficiency?
smaller than,
Well, just back to, I know the vaccine process, how it's going, but talk to me about how,
so, sure, this site is about 13,000 square feet. And so we looked at that and looked at how many people can safely be in there and stay 6 feet apart, and what is that kind of determines our capacity for how many we can move through a day. We do have plans potentially in the near future to move to a larger site at this same location. But we're working through those things now, but we wanted to get started at this central location as soon as possible.
And how many do you expect to vaccinate here?
We can very comfortably do 1,000 plus a day. I think tomorrow for second doses, because second doses move a little faster. I think we have scheduled about 1,500 for tomorrow.
We'll take one more question.
Mr. Collins, you were talking about tomorrow releasing more information about the numbering system. Can you talk a little bit about that? And also, we've been getting a lot of questions about just residency. Obviously, you guys came out, well, the state came out with that last week, talking about how now they have to show proof of residency or part-time residency. How are you guys doing that? Is that the day of? Is that when you guys call them to confirm those appointments? Or are you guys going through them to minimize the number of people on the list in order to send those appointments?
So we'll break that up into two parts. I'll take the first part on the account system, and Chuck will handle residency. So on the account system, as each citizen came in, they set up their account. Those accounts are sequential in order by the time that they set them up. We'll be setting up or working on setting up an account number that sequentially goes through. Then that will be made available on their login page, so they'll see where their number is in line. Concurrently, on our website, we will be putting up what we're serving up to. So if we put out 1,000 a day and we're at 3,000 total, we'll be serving up to account number 3,000. So that's how they'll be working that. We do have accounts in the system that may be partially done. Maybe a husband and wife, the husband set up an account at the same time the wife was setting an account up, and they made both themselves primary. So obviously there's a lot of data in the system. They're working to try to put them together, but we're putting out the account number so individuals know where they're at. And then that'll start. What we're finishing up right now is a script that will automatically, for any new registrations, add them on in the morning so that process is automated. Once that's done, we'll put that system out there. Our social media team will be putting it out on social media. We'll have it up on our website, and we'll have all the information on how to access it and how to get the information where you're at. And I'll switch over to Chuck.
So, on the residency requirement, and the information is all posted on our webpage as well as the county's webpage, and we're following the public health recommendations from our state surgeon general. So anybody that's a Florida resident, has a Florida driver's license, Florida ID, that's all they need. If they're not a Florida resident, we need an ID, picture ID, so we know who they are. And then they should bring 2 documents that help confirm that they're a part-year resident, because we want to make sure all our part-year residents get vaccinated. They're part of our community. And so there's a list on the website of what types of documents and suggested documents. When we were checking that, when people check in for their vaccine, we're asking them to bring their ID and those documents so that we understand that they're a part-year resident, and then we move them through and get vaccinated.
And you're not allowed no walk-ups here.
We're not doing walk-ups, and let me explain why. There's lore out there. If you hang out here at the end of the day, there might be some extra doses or whatever. We discourage that, because what we end up with is hundreds of people hanging out at the end of the day, and we really don't want that. We're trying to do it by appointment only, and we're working really hard to have the correct number of appointments for the number of doses. The Moderna product we work with is a 10-dose vial. So when we get down to the end of the day, we want to make sure we have final 10 people lined up before we open that last vial, because it's really important to us not to waste a single dose.
One more
All right,
question. So, your employees and people that are working here, are they county employees? Can you explain, are you hiring people? What is going on with, all we hear is you're short-staffed and you don't have enough people. How are we gonna make sure we have enough people?
So I'm not sure where you heard that, but we've been managing primarily with health department staff and volunteers to the health department. We are beginning to expand our volunteer list. We talked to the county about potential help from them as we get to a larger volume and need it. And there's a number of resources the state is making available in terms of lists of volunteers. Our local Sarasota County Medical Society is compiling a list of local medical providers that want to come help out. So there's a tremendous amount of opportunity for volunteers. And once we get into this space so we can schedule out daily, long-term, we'll be able to begin to pull those groups in and expand our workforce.
And how is the original?
That's going to have to be it. Thanks to everyone for coming. Tim, I'll help you with any follow-ups you have
I
later
just have
and
one
anyone
question
else.
for him.
Thanks to all for joining us today. And we'll be putting more updates out both online and through Facebook and